Thank you, Mr. Chairman, and thank all of you for your service and for being with us today. And let me start out also by thanking the Department of Defense for a heroic effort and a great job. General Perna, when I think about the contribution, the obvious contribution, I guess, and maybe I wouldn't have thought of it at the beginning, that the expertise of the military brings to Operation Warp Speed. Just thank you so much. And I've joined Senator Kane and Senator Ernst and the others who have pointed out that but for our National Guard, I'm not sure where many states would have been. In North Dakota, they are, along with their frontline healthcare workers, the unsung heroes who brought a level of expertise and logistics that provided efficiency and productivity to everything from standing up temporary hospitals to certainly to the testing and now to vaccine distribution. So thank you to all of you for that. I want to ask you, General Perna, specifically about vaccine manufacturing, and I want to be able to be part of the solution, perhaps. It's my understanding that a lot of the messenger RNA vaccines use raw materials that are developed at Aldevron in Fargo, North Dakota. Aldevron is both the most advanced and has the largest capacity of any DNA plasmid company in the world. And for several months, the company has been trying its darndest to get a meaningful meeting with somebody from Operation Warp Speed. I've tried to facilitate that. We've been largely unsuccessful, with some progress recently. On January 19th, Aldevron finally sent a letter to Carlo Di Stefani. Obviously, you work closely with him at Operation Warp Speed. And it's my understanding that they finally received a return call within the last week. That's taken way too long. But I think that there's been a tendency to overlook some of the mid-sized, maybe Midwestern problem solvers. And as we build a domestic supply chain, which I commend you and the whole government for doing. We need to do that. Certainly, COVID-19 has exposed some frailties in our supply chain, not just of pharmaceuticals, but lots of things, food supply and others. But I don't want to leave out a problem solver that that could help solve the problem. Now, I'm not an expert, obviously, but you are, and you have people who are. Aldevron is, and they have people who are. I guess my ask of you would be today, General. First of all, have you seen the letter, the one I referenced from Aldevron on January 19th?
No,
okay, I'm gonna leave it here, and before you leave here, I'm gonna make sure that you have a copy of it, and I commend it to you. Now, I want to know if well, would you just commit to me to personally taking a few minutes, and believe me, it is not lost on me that you have other things to do. But I'd love the commitment that you'd take some time to look at that and make a call and spend some time familiarizing yourself with this fantastic company in Fargo.
Senator, you have my commitment. I will personally call and talk.
I very much appreciate that. And as I said, and hopefully you'll be inspired to send a team to Fargo,
not in the winter.
You haven't been there if you haven't been there in the winter, General. But anyway, whatever works, we're grateful for that. And again, just let's build, let's shore up our own supply chain, and I want to be part of that solution. And with that, I'll yield.
Thank you very much, Senator Kramer. And I have been to Fargo in the winter. Yeah. Let me recognize Senator King via WebEx.
Well, thank you very much, Mr. Chairman. And first, I want to begin by acknowledging former Chair Inhofe, because these hearings really started last March. It was the only committee that I serve on that was really actively engaged in determining the role of what was going on. And I remember having hearings from quarantine and various places around the country when this was just getting started. So I want to acknowledge Chairman Inhofe's leadership for getting us engaged in this process at the very earliest stage. I also want to recognize, goodness knows I've had my major differences with the prior president, but setting in motion the Operation Warp Speed was an important initiative, and it has been amazingly successful. The standard I use with my staff whenever they say it'll take a year to get this done, I always say, don't forget, Eisenhower retook Europe in 11 months. And General Perna, you beat that extraordinary deadline under very, very difficult circumstances. So I really think that has to be acknowledged. There are plenty of other failures to be discussed, as Senator Kane mentioned, but I think it's appropriate to recognize success when we see it in the development of the vaccine. The question I'm interested in is the distribution. And General Perna, my principal question is, where are the current bottlenecks? Is it manufacturing? Is it syringes? Is it the middle mile? Is it healthcare professionals at the end of the line? Where is there? What can we do now to try to address whatever bottlenecks are remaining to get these shots into the arms of hundreds of millions of Americans?
Senator, just for reference, we purchased and being delivered every day all the syringes and needles and all accessories necessary for administration of the vaccine, so that is not a shortfall, and they're delivered accordingly. Currently, it is the volume of supply that we have access to. With that said, I will tell you it's increasing very rapidly. When we started in December, we were shipping roughly 4 million doses a week. As of this week, we're averaging 15 million doses a week. And come mid-March, maybe about 21 March, we'll be shipping as much as 30 million doses. We knew that the ability for the manufacturing to meet the requirement would have to scale accordingly, and they are getting there quickly. And as hopefully we add Janssen to the portfolio this weekend, and then in the future, AstraZeneca and Novavax will have even more for distribution. That it is the supply that is the holdup. Over.
So there's no there are no doses sitting somewhere in warehouses waiting to be distributed. It's the supply at the very first stage, but the remainder of the distribution network, even down to the healthcare professionals in individual sites and individual states, that is scaled up, you believe, sufficiently?
I am 100% confident in that. The state and local governments have done an exceptional job. As I alluded to earlier, we've increased provider accessibility from roughly 7,000 locations to over 130,000 across the entire country. So our ability to deliver and then administer is equal to the amount of supply that's available.
Well, I want to end with a question to Ms. Cummings, and really it's a reiteration of Senator Cotton's question. And I think this goes for both of you. One of the most effective things about the military is the after-action review. And of course, we're in the middle of the action right now, but to the extent you can assess, Ms. Cummings, problems in the Defense Production Act, for example, authorities, timing, how it actually is executed, that would be very helpful to us. And the same thing for you, General, in terms of distribution. Are there authorities, are there elements of the effectuation of your work that can be improved by changes in statute and things that we can do to help? So I hope both of you will supply us after this hearing with any written suggestions you have for authority changes or other things that we can do based on the now extensive experience you have dealing with this catastrophic situation. With that, I want to thank all of our witnesses today, as all of us have, for really extraordinary work. And we want to be sure that we support you in every way possible to complete this work and end this terrible chapter in American history. Thank you, Mr. Chairman.
Well, thank you, Senator King. Let me recognize via WebEx Senator Blackburn. Senator Blackburn.
Thank you so much. I appreciate that. And General Perna, I want to thank you for your time yesterday to talk through some of these issues. There's been a lot of conversation around the issue of red tape and things that are getting in the way. So I want to go to the other side. are you all really compiling best practices and beginning to say, going forward, or if we have another situation, if there's another pandemic, these are going to be the methods that we will move forward with best practices?
Senator, absolutely. We are being agile and adaptive to what's facing us now. We don't want to fight the plan. We want to fight the enemy and execute accordingly. And we have a very rigorous and detailed process to capture our after-action review comments and recommendations. Over.
Well, thank you for that. And I think it is important as we look at bringing the J&J vaccine online and picking up the pace as we are getting vaccinations, those shots into arms for our active duty, for our veterans. I think it is just so important that these best practices evolve and be put into place. And yesterday, in our conversation, you mentioned FedEx, and they are a Tennessee treasure. And we're so pleased to have them participating in such an aggressive way. And I think that the relationship between DoD, FedEx, and other government entities really shows that a public-private partnership can, and highlighting the strength of that approach of a public-private partnership, can go a long way in tackling some of these complex issues. And we know that you're going to continue to work in that regard. We also talked a little bit about our Tennessee National Guard and the good work that they are doing. They are certainly leading the nation in supported static vaccination sites with 560 personnel at 60 sites. And as each state or metro area is responsible for its own internal distribution of the vaccine, there have been variations from jurisdiction to jurisdiction. So given this flexibility, in your opinion, how have the diverse approaches to distribution enabled or hampered the ability of Americans to receive the vaccine? And then there again, what are the best practices and the lessons learned in this regard?
Senator, it's not lost on you, as we discussed. The flu vaccine is a pull. So every year we order, throughout the jurisdictions, and then pharmaceutical companies manufacture and distribute directly to them. What we've been doing with the COVID vaccine is we produced, and as it comes available, we're distributing it simultaneously throughout the country. And you can see great successes in many of the jurisdictions because of their detailed planning, execution, support by the National Guard, et cetera. And those lessons we're capturing holistically so that we continue to not only share today in jurisdictions, but that we get it ready for the future. Because, what we do believe is if there is another pandemic, it'll be the same type of situation where we'll have to push the vaccine upon availability. And so we want to get into this routine and normalize it. Thank you.
Thank you. Ms. Cummings, I wanted to talk with you for just a couple of minutes about supply chain and the defense industrial base. There are some of us that were at the White House yesterday working on the supply chain issue writ large, whether it is pharmaceuticals or semiconductor chips. And I'd like for you to speak briefly to what you're doing to maintain the supply chain integrity with the ongoing resource strain that you have, and really what keeps you up at night in regards to that supply chain.
So thank you for that question, Senator. I would call out the industrial capability report that our office released earlier this year that does look at fragility in the defense industrial base. I would agree, working in the interagency on the pharmaceutical industrial base, onshoring those precursors and APIs is critically important to both national and economic security. As far as the companies that make up the defense industrial base, we took actions very early on to increase progress payments. Through that process, we were able to infuse about $4 billion into the defense industrial base of funding they would have received anyway, but we pushed that earlier so that they could push those progress payments, our primes, down to our second and third tier mid-level and small businesses. And so we had a lot of success in helping to sustain the defense industrial base and mitigate those impacts that COVID would have on those critical supply chains. So thank you.
Thank you. I yield back my time.
Well, thank you very much, Senator Blackburn. Let me recognize Senator Warren via WebEx.
So thank you, Mr. Chairman, and thank you for being here, General. Last October, Senator Perna and I requested a hearing on DOD's role in developing and distributing COVID-19 vaccines, and I am very glad that this is one of the first topics that you are addressing as chairman. So thank you very much for that, Chairman Reed. I asked for this hearing because the federal vaccine effort called Operation Warp Speed by President Trump was characterized by ethical conflicts and mismanagement. And one of my biggest concerns is a lack of transparency. OWS issued billions of dollars worth of vaccine contracts, but with too little accountability on that. Last year, DOD issued $6 billion in contracts to a defense contractor, Advanced Technologies International, Inc. This company then issued subcontracts to various pharmaceutical firms in an arrangement called an Other Transaction Authorities that allowed pharma to bypass regulatory requirements and that limited disclosure. So, General Perna, what is the rationale for this subcontracting process other than to reduce transparency and avoid regulatory and ethics requirements?
So, Senator, I can't speak broadly, and I'll defer to my colleagues here at the table, but for OWS and the work that we've done, we've worked really hard to remain transparent in coordination with the GAO and to make sure that everything we're doing is legally, ethically, and morally correct. And we've provided all of our contracts to them so that they can be a part and help us see ourselves and work our way forward.
Well, I appreciate that, General, and I appreciate the need to move quickly. But I think that transparency, giving up transparency, particularly when billions of dollars of taxpayer money are involved, is not the right right approach. So let me just ask you, moving forward, will DOD commit to procurement transparency on our federal vaccine efforts?
Senator, I apologize, but I can't commit for DOD. I'd have to go to my colleagues.
Senator, this is Stacy Cummings from Acquisition and Sustainment. We do send a monthly report to Defense Committee staff that I will make sure that your staff has a copy of. And what I can commit to is that we will continue to be transparent in how we are spending both DOD funds as well as interagency funds. The Other Transaction Authority is a tool that helps us move quickly. It is not meant to in any way stop us from being transparent. I would be happy to come and brief you or your staff on Other Transaction Authorities and the benefits. Happy to do that at your convenience.
Well,
and
I appreciate you saying that you want to be transparent, but just saying you're going to continue the current level of transparency is just simply not good enough. You know, the structure of the contracts are part of the problem. The terms in these contracts were bad too. Public interest groups had to fight OWS to release its contracts. And when it did, it became clear that the Trump administration had sold out the American public. Key contracts, including the contracts with Pfizer and Johnson & Johnson, excluded critical taxpayer pricing protections. One expert described these contracts as giving away the store. So let me ask the question another way, based on what we know. I'll go back to you, General Perna. It seems to me that DOD should serve the American taxpayers, not massive pharmaceutical companies. So moving forward, will you commit to writing and developing vaccine contracts that protect the American people instead of pharmaceutical executives?
You have my 100% commitment to that end.
Good. I am very glad to hear that. You know, given the massive taxpayer investment and public health interest in COVID-19 therapeutics and vaccines and other medical products, the American people deserve to know that the federal government is using their tax dollars to develop medical products as quickly as possible and at the very best possible price, not to line the pockets of wealthy companies by cutting corners in consumer protection or pricing or quality. So I recognize, General Perna, that you may have been limited by the previous administration in many respects, but I'm noting for the record here and now that you have committed to do a good deal more, and I will hold you to that commitment. Thank you very much. Thank you, Mr. Chairman.
Thank you, Senator Warren. Let me recognize Senator Hawley.
Thank you, Mr. Chairman, and thank you all for being here and for answering our questions today. Mr. Solisas, could I just start with you? I've heard from constituents in my state, which is Missouri, that the Department of Defense is not releasing information about the number of service members on a given installation who have been vaccinated. Is that correct, to your knowledge?
I don't know exactly what's being released in Missouri. We do keep track of the service members that have been vaccinated, and so we do have that information if you'd like that, Senator.
Would the department consider, do you think the department should consider releasing this information so that states and local communities have a better sense of who has been vaccinated, what the vaccination rates are around these installations?
I think that's reasonable. I think what we're talking about is releasing when we vaccinate somebody, we share that information with CDC, which can share that with the public health individuals in the state to make that available to them. So I'll look into that, Senator.
Great. I appreciate that. Thank you very much. General, let me ask you, and Senator Tillis, I think, asked a somewhat similar question, but I think this is important, so let me just come back to it. What, in your estimation, are the most important steps that we can take to ensure that civilian agencies lead responses in future public crises, with the department supporting, of course, but in a way where the civilians are leading the response so the department can stay focused on its vital mission, which is defense?
Senator, I think the key word I would tell you is being able to operationalize to effects. Right now, my assessment, right, albeit not very experienced in this world, because I've been in the Army for 38 plus years, is that very, very good at policy and defining, how things ought to be, but executing is a shortfall. So how do you operationalize to the effects that you want is the reform, I think, that'll be necessary in your assessment when you look at these organizations to do something similar as a potential future pandemic.
Do you have anything to add to that, Mr. Solisas?
Senator, I do. Most of the organizations obviously are regulatory organizations. The U.S. military and the Department of Defense have tremendous operational capability. I think going forward that there will always be that partnership where the Defense Department will partner with our federal partners in support of state and local authorities. I do think that there are opportunities for other federal departments and agencies, particularly as you see the acquisition business that we're in now. There may be the opportunity in the future to have that kind of contracting capability, because what we're doing really is leveraging the private sector here in the nation to respond to this crisis in a lot of ways. So how we do that going forward as a federal government, across the federal government, will be very important.
Very good. Let me ask you, while I have you still, Mr. Solisas, how COVID has affected the department's operations around the world, and I'm particularly interested, have we seen any sustained impact in operational tempo, and particularly in Indo-PACOM, our pacing theater?
Senator, as you know, the department every day tracks the readiness of the department, and I want to state unequivocally that we're prepared to meet every mission that we have in the Defense Department. Now, with that, obviously, we've learned a lot, how to adapt and how to operate in the COVID environment, and we're using that. Our accessions, we're meeting our accessions right now. Our follow-on MOS schools, our service schools, all of those things are full up. We're using virtual type of capability to make sure that we can continue the education programs that we need to for our military members, our training, our exercises. Obviously, some of that has been curtailed, but we're finding ways to adapt and make sure that we're maximizing both the individual and collective training that we need to execute to ensure that we can meet our missions. And we're monitoring this very closely as we go forward.
Good, very good, thank you. Ms. Cummings, can I just ask you, how has the department's response, I should say, to COVID impacted the pace of modernization and then any other priorities in the acquisition and sustainment space?
So thank you for that question. Some of the, we have had to adapt to telework. That is one thing. Program offices are very used to being all together in one place. We've had to adapt to that, and I think we've done a fantastic job doing that. When I initiated the Joint Acquisition Task Force to assist HHS in assisted acquisition, we never met our teammates. All of our work was done on the phone. We created policies so that we could do things electronically that previously all required paper, actual pen and ink to get contracts signed. So we put a lot of different policies in place for us on the government side, and we also created flexibilities for our industry partners so they could continue to meet our needs. There are some things that did have to get pushed back. The Section 3610, for example, of the CARES Act gave us the ability to reimburse contractors for paid leave. Due to COVID, we didn't receive an appropriation for that. And so there are some things in the future that could impact modernization, and we're working through that to better understand it and be able to share that information. Thank you.
Very good. Yeah, thank you for that. Thank you all for your testimony and your tremendous service. Thank you, Mr. Chairman.
Thank you, Senator Hawley. Let me now recognize Senator Peters. Senator Peters.
Thank you, Mr. Chairman. Recognition. And to each of our witnesses, thank you for being here today, and thank you for the work that you do each and every day. You certainly have a lot on your plate, and we appreciate your efforts. I want to start off first to just say that I concur with the comments that Senator Kane made earlier broadly about how we have handled or not handled this pandemic up to this point. But I want to particularly concur with the fact that we're going to need to do a complete analysis of what happened, what went well, what went bad, an after-action report to get a sense of how we deal with a future pandemic. We know a pandemic, it's not if there will be a pandemic, it's just when. And the unfortunate part about that, according to many scientists and epidemiologists, is that we're likely to see more of these, not fewer of them, and for a variety of reasons, complexity of the world, et cetera. So we better get this right next time as we go forward. And that will be a commitment that I'll be making. I'm chair of Homeland Security and Government Affairs as an oversight committee. We plan to do a pretty in-depth investigation into this, as well as other committees I'm sure will be engaged, and your continued input in that process will be appreciated and essential for us to get the kinds of answers that we need. General, Perna, a question for you. You've talked about the capacity that we have now to put injections in arms and supply, talked about the increase of supply. Right now we have a situation where there is actually more capacity to deliver vaccines than there is actual vaccines coming in. We're seeing that in the state of Michigan right now. We can do a whole lot more. The good news is, as you mentioned, is that that production is increasing. I had the privilege of being with President Biden last week in Michigan at the Pfizer manufacturing facility outside of Kalamazoo and Portage. We take great pride in Michigan that we're making efforts in making the vaccine in our state. And when I was there, they were producing 5 million doses a week. I understand next week they will be up to 10 million doses a week, and roughly 300 million doses will be delivered, I believe, by July, which that's about half the American population will have doses available, and that's just Pfizer. We got Moderna and others that will be coming online as well. So we're going to get to the point where there's going to be a whole lot more vaccine than there will be capacity to actually put it in arms. So we have to align all that. What I'm finding is a problem that I'm hearing from my folks is that right now the visibility of when vaccines are actually coming to them is not great. It's getting better, but I'd like you to talk about how it's going to get even better so that you know not just what you're going to get next week, but what you're going to get 3 weeks from now and 4 weeks from now, because it takes considerable planning to have that capacity ramp up to match those vaccines coming in. And then we're going to have to bring in even more capacity. FEMA, as you mentioned, will be setting up federal facilities. We're hoping to get one of those in Michigan soon. Walk me through, how are we going to make these aligned? How are we going to have greater transparency? How are we going to make sure these are more aligned so that we don't have a mismatch of too much capacity, not enough vaccine, and then move from too much vaccine and not enough capacity?
So, Senator, I think to start with the communication from the White House to the governors on a weekly basis has been very helpful to get the word out. And one of their commitments was to put on Tiberius 3-week projections so that everybody could see what's coming their way. The rule of thumb is we will never go backwards, so you'll never receive less than what you've received already on a weekly push, but always try to increase, but to give that predictability. We're working on, and we think we have good fidelity on what we think the numbers are going to look like based on EUA for future companies and max capacity, so that we know, for instance, and I've been to Kalamazoo many times, that both Pfizer and Moderna will probably hit their peak capacity around 21 March. And so we know that's roughly 24 million doses of vaccine the two companies will produce on a weekly basis. We know that Janssen will come, we believe, with EUA hopefully this weekend, and they will start producing in a regular rhythm of 5 to 10 million doses a week so that we can project to everybody what we think the mass volume is going to be pro rata. And we're working to distribute that accordingly to all the states. 100% agreement with you.
Great. Well, I appreciate that. In my remaining time, we're going to pick up on an issue related to defense establishments and the fact that recent surveys show that about 60% of Americans are willing to take this vaccine now, which will also be, as these vaccines come in, we actually have to make sure we have the capacity and Americans that want it. Right now, the demand exceeds supply, but that will change. But my concern is that surveys show that, I think the most recent one showed that the rate among military families is about 33%. That's a real problem, and I'm really worried about communities that host defense facilities, that a community could be doing a great job and getting 80% of the folks vaccinated in the community, and yet folks on the military base in their communities at 33%. That's simply unacceptable. How are we going to change that? That risk an entire community if military personnel are going into the community are simply not vaccinated. How are we going to address that?
So, Senator, we know that the vaccine is safe. It's the right thing to do. We're meeting all the time with our leadership teams at every level in the Defense Department to educate people and make sure that they know the value of the vaccine and the importance of it. And I believe that that education, again, we've been at this for about 60 days. I really believe that that will make a huge difference, and the continued emphasis by our leaders at every level in the Defense Department will make sure that we improve upon that number.
And having transparency in that data so community knows, a previous question, is really important. Community has to know what's happening at that base with all of those people there. So I hope that's a priority for you.
Senator.
Great. Thank you. Thank you very much, Mr. Chairman.
Thank you, Senator. Senator Tuberville, please.
Thank you, Mr. Chairman. Save the best for last here, I guess. I know it's been a long day. Thank you for your efforts. Thank you for the miracle that y'all pulled off. I know you've heard some rhetoric here today that's a little strong, but it's not against you. A lot of them didn't like our president, but that's fine. He got a lot done, but you got a whole lot done. You know, I was campaigning last year over the whole state of Alabama, and I was telling people, everybody's asking about, Coach, what do you think about this virus? I said, well, I don't know, but I will tell you this. China's not going to come up with the answer. Russia, Europe, United States of America is going to come up with the answer. And you did. You worked hard at it. Most of you probably hadn't slept a lot in the last year. Thank you for what you've done. Some are saying, you know, it's been a disaster. A lot of them in this building 20 years ago voted to send our manufacturing to China. What the heck do they expect? We need to get our medical supplies made in this country and quit putting the blame off on other people. And I hope you would agree with that, because we've all gone through that. I'm proud of Alabama. We are making in Huntsville, Alabama, Ream Corporation is making refrigeration for the vaccine. In Auburn, where I live, we're making millions a month of vials that are plastic, that are blowing glass into the vials to store the vaccine, to be be given out. I'm proud for what Alabama's done and a lot of the private sector. I hope you have enough money. You know, we're out there right now trying to spend money on bridges to nowhere and tunnels when you need every dime you can get because our kids are not in school and our people are not at work and they're scared to death. But it's helping. I was in Alabama last week going to the military bases, and the commanders there are saying we are getting vaccine. They're communicating, and that's all we ask. Just communicate. Tell them what they're going to get. Fort Rucker trains every vertical lift pilot in the country. For those of you who don't know, it's helicopters. We need them trained. They're in the air almost 24 hours. And for every pilot, there's about 10 people on the ground waiting for it to land, to maintain it, and put the fuel in it to continue to go, to train. They're getting their vaccine. So I want to thank you for that. I just hope today you leave here knowing that things are positive. In our state, it's going down. We can see the light at the end of the tunnel. We're not there yet. We need to continue to social distance and do all the things we need to do. But I just wanted to end on the note that we want to thank you for what you're doing. But say one thing. I've been in recruiting all my life and in pretty much sales, being a football coach, and marketing. We're going to get to the point where people are not going to take this vaccine. We've got to the point, some in Alabama, where at one point 3 weeks ago, 40% of the first responders were not taking it. 40%. That can't happen. So I would just express upon you and ask you your thoughts about marketing. Sooner or later, we're going to go on television, and we're going to have to get out there and have people get in front of the camera, well-known people, people that are average day workers, saying they've taken it and it worked. And we're going to need to do that because we need this country to get back to work, or we're going to lose our country. It's not going to be all the mess that we got going on right now. It's going to be this virus is going to bring us to our knees. China's on the run. They're running past us as fast as they can, and we need to get back to work. And we need to get our eyes on other things. So what's your thoughts, all three of you, thoughts on marketing, probably starting here in the very near future?
Senator, I agree with you 100%. And I know HHS and the CDC are developing and working that now to start expanding that as we go forward. And so we believe, as simply said, it just needs to be a reflection of society saying that they took the vaccine so that others can see it. And that's what they're working on now.
It's building confidence and using the right people to reassure the public and make sure that the American citizens know how important it is to take the vaccine, not just for themselves, but the others that they work around, their families, the co-workers, and those kinds of things. And building that confidence with credibility is what will turn the table on.
So I've worked for the federal government my whole career, so I am not a marketing expert. I can tell you my husband and I actually participated in a vaccine trial. And I think that the best way to give people confidence is that they understand the process, the diligence that went behind the trials, and that real people, real Americans participated to ensure it was safe and effective for them.
I hear 75% of people have to have vaccination before we feel safe. Is that true or false?
I can't speak to that specifically, Senator. I know it's something similar to that, but the scientists would have to give you an update on that.
Thank you. Thank you very much.
Thank you, Senator Tuberville. I want to thank the panel for a very informative and thought-provoking hearing. I particularly want to thank you for your individual tireless efforts to deal with this crisis and to be innovative and creative, and it has been a very significant challenge, and you've met that challenge in many respects, but I think we understand there's more work to be done. We look forward to working with you to get that work done, not only to defeat COVID, but to prepare ourselves for other pandemics that could be coming down the road. So thank you again, and with that, I will adjourn the hearing.
Thank you, Chairman.
Thank you.